Hereditary spherocytosis, HS, is a genetic disorder impacting red blood cells. In HS, red blood cells lose their characteristic biconcave shape. Affected cells become spherical, a condition known as spherocytosis. This altered shape reduces the flexibility of the red blood cells. The spherical shape also makes the cells more fragile and prone to premature destruction. Hereditary spherocytosis, HS, arises from genetic mutations. These mutations affect genes encoding proteins vital for red blood cell structure. Key proteins impacted include spectrin and ankyrin. These proteins constitute the cell's cytoskeleton, providing shape and flexibility. Defective proteins weaken the red blood cell membrane. The spleen functions as a blood filter, eliminating damaged or abnormal red blood cells. In hereditary spherocytosis, HS, red blood cells are spherical rather than the typical biconcave disc shape. These spherical red blood cells are less flexible, hindering their passage through the spleen's narrow capillaries. The spleen identifies these misshapen cells as abnormal and destroys them prematurely. This accelerated destruction leads to hemolytic anemia, a deficiency in red blood cells. Diagnosis of hereditary spherocytosis, HS, involves microscopic examination of a blood smear. A key indicator of HS is the presence of spherocytes in the blood sample. Spherocytes are red blood cells that appear smaller and rounder than normal. Flow cytometry can quantitatively assess the spherocyte population. This quantitative assessment aids in confirming the diagnosis of HS. Treatment for HS is tailored to the severity of the condition. Folic acid supplementation is commonly used to aid red blood cell production. Severe anemia cases might require blood transfusions. Blood transfusions help increase the red blood cell count in critical situations. Splenectomy, the surgical removal of the spleen, is sometimes recommended for severe HS, reducing the rate at which red blood cells are destroyed. This reduction in red blood cell destruction helps to alleviate anemia, a common symptom of HS. Splenectomy increases the risk of infection, necessitating vaccinations and prophylactic antibiotics. That's today my named.